Asalamoalykum friends and colleagues. Welcome back to my channel, which is all about healthcare, business, and dentistry. I'm your host, Dr. Suhail Shabir Ahmed, and today we'll be discussing managing dental pain, part 4. In the first part, we discussed what to ask your patient regarding the pain. In the second part, we discussed how to identify that pain and what are the reasons behind that pain. In the third part, we discussed the 4 P's of managing dental pain. In the last part of this series, I am going to discuss what precautionary measures should you tell your patients, how you should inform your patient what to look out for. There are many misconceptions circulating among the patients regarding dental pain and dentistry. One of the common misconceptions that patients usually come to me with, they say that we were experiencing pain and someone in their family or a friend of theirs told them to do warm water gargles for the pain for relieving of the pain, and the result was that there was no improvement. They even took the medication. They went to a medical store, got the medication without doctor's prescription, I might add, and still there was no pain relief. In such a case, you should inform your patient that in case of dental infection, when they apply some thing warm, the pain is going to increase. Let me give you an example. When you have some sort of a blister on your skin, which which has pus inside it, doctors advise you to apply a warmth on it. While keeping warm, the swelling bulges up, it pops up, it bursts, and discharges pus, thus relieving pain to a much greater extent. However, when it comes to dental pain, it is quite different. Even though the same principle works, but the same principle results in even more difficulty for the patient. When we talk about dental pain, we have a tooth, and underneath the tooth, we have the bone. When the patient develops pain due to infection, the most common reason is periapical infection. A lesion develops underneath the periapical region of the tooth. If you advise your patient to apply warmth on it or do warm water gargles, the problem with this is the pus will start forming and the pressure of that in the periapical lesion will start increasing. The problem is, as opposed to skin, which has an opening, which has a place to burst open, the periapical lesion does not have any place to open. So the pressure builds up because above the periapical lesion is the tooth and below it is the bone. Where is the pus going to discharge at? So the pressure builds up, thus resulting in tooth slightly raising from occlusion. And patient also complains that on biting, he or she can feel that the tooth has slightly raised in the occlusion, thus resulting in even more pain. So, when the patient comes to you, you should trim the occlusion 1 to 2 mm, 1 to 2 millimeters, so that the upper and lower teeth, when they do not come in contact with the infected tooth, the pain is not aggravated. Secondly, you should inform your patient to apply cold or to do cold pack application. This not only decreases the pain significantly, but it makes it easier for the patient to go through with the pain and taking medications and have a good night's sleep. It must be understood that some patients do complain that even though they have periapical infection, yet they say that the cold aggravates the pain. In such a case, you should advise your patients to do cold pack application externally rather than doing it internally. But you should tell your patients to not do warm water gargles in any infection, as this, especially dental infection, as this could increase the likelihood of pain. Another thing that you should advise a patient is that patients should not do self-medication. This is a very common problem in third world countries like Pakistan, where patients just simply go to the medical store, and the medical store owner, who is not, and mind you, who is not even a pharmacist, just ask the patient what his or her problem is, and they just prescribe medicine without any proper knowledge of the medications or of the diseases. You should advise patients not to indulge in such practices. This, when it comes to pregnancy or lactating mothers, you should tell them that taking such medications or doing self-medication can result in harm to their baby, whether it is intrauterine or breastfeeding. And it can also aggravate their own medical problems. For example, a patient came to me once complaining that she has a dental pain, and she asked her brother or husband to get her some medication. He went to the medical store, he took a pyroxicam analgesic and gave it to her. Next day, when she came to me, she said that the pain had, not only that the dental pain has not improved that much, but she is complained that her peptic ulcer problem has also aggravated. When I asked her about, and when I took her entire medical history and dental history, I came to the realization that she was a case of self-medication. Thus, the self-medication resulted in aggravation of another medical problem she was already suffering from. So, you should advise your patient that they should refrain from self-medication practices. Thirdly, tell your patient that the medical store owner is not a qualified person to hand out medical advices. They're not even pharmacists, even though by the law of Pakistan does dictate that a medical store should be run by a pharmacist, but in reality that's not the case. Anyone and any Tom, Dick, and Harry with a few lakh rupees can open up a medical store, and nobody bothers to ask them why they are doing such malpractices. So we should at least advise our patients to refrain from such people who are giving medical advices, even though they are not qualified to give it. Firstly, because they are not doctors. Secondly, because they're there to sell their medicines. They don't care about whether the patient's pain is relieved or not. And thirdly, if, for example, the pain is not relieved, they will not take any responsibility for their actions. So, it is better to refrain from such people. And I give an example to the patients. When it comes to uh, special occasions like weddings, when they want to get good food for their guests, I ask them, why don't you go to the tailor? Or when you want to get good clothes for yourself, why don't you go to the cook? They are very conscious about the food should be cooked by the cook and the clothes should be made by the tailor. But when it comes to their own health, they are experimenting with themselves, and they are putting their lives in the hands of those who are unqualified to do so. So you should advise them to always seek professional advice from the person who is eligible to give advice regarding their problem. So tell me, you don't forget to tell me in the comments uh, what advice do you give to your patients. If you like this video, give it a thumbs up. Do share it with your friends and colleagues if you found it to be useful. Subscribe to my channel and don't forget to push the notification bell so that you don't miss any of the notifications. And you can also follow me on social media, Facebook, Instagram, and Twitter. Assalamu